Hi, I'm Grant Colfax. I'm Director of the Office of National AIDS Policy at the White House. And I'm here at the U.S. Conference on AIDS, where I just moderated a session with my colleagues from CDC, HRSA, and CMS. I asked them what are the most critical aspects of implementation of the Affordable Care Act that their grantees, and most important, people living with HIV/AIDS need to know. Here's what they had to say.
Prior to the Affordable Care Act, many people with HIV could not get insurance because they had a pre-existing condition, which is HIV. Now, people with HIV can get insurance because they cannot be excluded from insurance on the basis of a pre-existing condition.
The Affordable Care Act embraces the concept that preventive care is health care. What that means with regard to HIV is that everyone between the ages of 15 and 65 years of age should be able to access HIV testing without any copay. The second aspect is that the Affordable Care Act covers behavioral counseling to reduce sexually transmitted diseases, or HIV, among people who are at risk for those infections. And again, that should be covered by most healthcare plans and Medicaid without any copay. So people can access these services without the added financial burden that can sometimes prevent people from getting the care that they need.
For people who are currently uninsured and get all of their health care through Ryan White, the Affordable Care Act offers huge benefits. Currently under Ryan White, based on our legislation, people do not have access to things like emergency room care, inpatient hospitalizations, or surgeries. With expansion of Medicaid and insurance available through the Affordable Care Act, all these services are now available. In addition, Ryan White clients can continue to receive those services not covered through insurance. Things like patient navigation through the healthcare system and linkage to care services and case management that they rely on. Those will still be available.
The Affordable Care Act will expand coverage to about 30 million Americans, including 7 million African Americans and 9 million Latinos. Open enrollment into the marketplaces begins October 1st, and coverage begins January 1st, 2014.